Good afternoon, Solve community. This is Pradeep Goel, and it is my great pleasure to speak to you all today. We are going to do a pretty detailed update on where Solve.Care is, and I look forward to hearing back from the community after this conversation. We have had a series of conversations during the Ask Me Anything sessions in the last couple of weeks, and many more are planned. But today is a more general and complete update of where Solve.Care is. And while there is a tremendous amount of excitement around our upcoming decentralized finance solution model that we are publishing for the community as a whole, today we have a lot more ground to cover around the normal business and our care networks and the adoption of Solve token in these care networks. So much ground to cover. 1 hour will be insufficient as always, but let's get started without further delay. So what are we going to talk about today? The first thing that I want to talk about is what is Solve token doing in the market and how it is becoming the currency of healthcare, and how through the adoption of various care networks, we are seeing Solve turn from a question mark into a true asset for the company. In the sense that what used to be a conversation about why do you need a digital currency and what does it do, to a conversation really about, wow, this digital currency that Solve.Care is and its nature and interaction with the Care.Wallet is tremendously valuable for patients and doctors. And it really is helping break down barriers in terms of access to care and timeliness of care and outcome of care. So a lot of discussion around what we have learned in the last 6 months and how Solve has become a true asset in the launch and expansion of care networks around the world. The second thing that I'll talk about is what we are doing in the context of DeFi and decentralized finance applications for healthcare. And we are really putting in a lot of effort to launch a truly community governed, globally scalable, decentralized finance solution for healthcare. And we are very excited about the real world applications of it. This is not a solution that is looking for a problem, but rather very specific problems that we are looking to address with this solution. And it truly is a massive opportunity for us and for the crypto community as a whole. The third thing that I'll give you an update, very excited to announce some expansion of our team and the announcement of our new Chief Financial and Administrative Officer, which is really important step as we look to mature the organization and get it ready for public capital events. And the creation of Solve.Care India, which I will tell you a little bit more about. We are very excited about that. We're already seeing tremendous results from the different time zones and the opportunity to serve our Asian customers and support them properly from that time zone. And then looking ahead, where are we going with Solve.Care and what really should you expect from us, which I can tell you we're super excited. 3 years at Solve.Care, working incredibly long hours with me and my team, whom I'm very proud of. These 3 years, we've probably done more work than most companies do in a decade, but I think the fun is really just about to get started. The real fun is not behind us, it's in front of us. So I'm more energized, more excited than I have been in a long time. And this really is a moment in time where we can say the moment of Solve.Care has come. So let's get into it. So first is that we're really excited about the diverse set of care networks that are now in the market or are about to launch. We started a journey in 2018 with the signing of a provider rewards network launch with Arizona Care Network. And then we expanded that journey with the Uber and Lyft partnerships to add non-emergency medical transportation. And then we launched the Boehringer Ingelheim sponsored diabetes care network. And then COVID-19 gave us an opportunity to launch a really interesting and really relevant COVID-19 and remote workforce well-being management network called Team.Care. And as you all know, we are currently working on launching a global telehealth exchange. Now, these networks are very different in terms of what problem they solve. Provider rewards program is about incentivizing and paying physicians in real time, be it in the form of fee-for-service or in the form of value-based care. Diabetes Care Network is all about giving the patient the information and the optionality and the actionability they need to coordinate their care with themselves and their family members, but also to be under the care of a nurse or a care coordinator, and to keep that entire triangle of patient, doctor, and care coordinator working in a manner that has never really worked as well as it can and should, and Diabetes Care Network really proved that. Team.Care is all about allowing employers to manage their employees, whether they work from home or remote or in the office, and to facilitate return to work as companies begin to recover from the COVID-19, but also recognizing that employee well-being is not just a function during COVID-19, but really permanent concern, as it should be for every employer. And then Global Telehealth Exchange is all about delivering unfettered access to care when the physician and doctor meet and match on requirements and services, and to do so in a manner that there is a global payment system underneath it, where any patient can see any doctor and pay for it instantly. We're going to talk a lot about GTHE today, because that's one of our most important, not that other networks are not, but this is one of the most important network in the context of truly global application of Solve.Care. So these all networks, and there are several future networks we are negotiating with clients and sponsors. And I'm very excited about the opportunities that Solve.Care platform is addressing, but we'll talk about that another time. The point I'm trying to make here is, while each of these networks independently is very powerful, the real value of this comes together when these networks work together through the single Care.Wallet. And that's the really exciting part. In our next release of Care.Wallet, the network switching with a swipe of a finger and ability to switch between Team.Care, GTHE, Diabetes Care, and every other future network that we will launch really makes our dream come true in terms of interoperability within the Care.Wallet. And those of you who know healthcare or have heard me speak in the past, one of my biggest goals in launching Solve.Care was to break away from this madness called interoperability of systems, where we invest worldwide hundreds of billions of dollars each year trying to get doctor system to talk to pharmacy, pharmacy to talk to insurer, insurer to talk to employer. And this interoperability is really actually cages in which you live and operate. And if you want to step outside the cage, you have to change careers, change countries, or change in technology stacks, and it is practically impossible. So interoperability is really about monopoly right now. Interoperability doesn't work. It likely will never work because there is business reasons why businesses don't communicate and exchange the information. And it is all to the detriment of the patient. So our vision is that Care.Wallet is interoperability hub, not some fancy, enterprise service bus, not some, health information exchange, not some agreement between, pharmacy and insurer to exchange claim data. It's just not the model of the future. Blockchain allows interoperability to happen at the consumer level, and Care.Wallet is the interoperability hub in the hands of the consumer. And the real value of that is when I can receive a care card from Global Telehealth Exchange physician and share it with my diabetes care physician, or I can receive a recommendation from my doctor, from my employer through my Team.Care, and with a swipe of a finger, send that recommendation for care model over to my provider. So this interoperability should be as simple as playing with a deck of cards. And our goal is to make care cards interoperable across networks, in which case we can make the patient truly the hub of all decision-making and all data exchange. And isn't that the fundamental purpose of blockchain and crypto? To give you and I, our families and our kids, control back over our lives? Isn't that how crypto really started? With the idea that we are going to change systems that don't serve us anymore. So this Care.Wallet and multiple care networks and the interoperability between care networks is exactly that mission realized. That is what crypto promised, and that is what Solve.Care is delivering. So let's take a look how this works. So let's say I download the Care.Wallet from the App Store, and I use that Care.Wallet to sign up for GTHE, and I join Global Telehealth Exchange because I'm a consumer or a parent, and I want to know what my options are for my kid to see a pediatrician, not just where I live and work, but where I can find the best possible care for him. So my ability to find a physician worldwide is as simple as me connecting to the GTHE network. And if I see a physician I like, I pay them in Solve tokens in real time, and I am off and running. But now let's imagine that my physician is who is on the Care network decides that they are going to need to refer me to another physician, and that physician here is Dr. S, who is, let's say, an endocrinologist. And Dr. S may or may not be on GTHE, but through a referral from my physician, Dr. D, they can simply join GTHE and become the next physician. When I do that, Dr. D can easily send a care card regarding me to Dr. S's wallet and suggest to Dr. S that they accept me as a patient and accept Solve tokens for that referral. But the objective here is that with a simple card swipe, Dr. D can refer me to Dr. S. And I can pay Dr. S directly for that care. And now let's imagine that the endocrinologist feels that my diabetes risk is too high and tells that to my physician, and the physician says to me, you know what, Pradeep, you need to sign up for Diabetes Care Network. And if you do that, I'll be able to do continuous care monitoring for your health. And in doing so, I can simply fall under the continuous care model of Diabetes Care Network and pay my physician a different fee model using Solve tokens. So instead of having a episodic care through GTHE, I can have continuous care through Diabetes Care Network or both. That has never been accomplished before. What I just described to you today in this simple graphic has never been achieved anywhere in the world that we know of. Because this process, simple as it sounds, would require an enormous amount of regulatory, legislative, and functional and administrative burdens that would make this process multi-week, multi-month-long journey, and most likely would never meet its original objectives to begin with. Now, let's say that my employer at the same time publishes a Team.Care network, and that Team.Care network is monitoring my well-being as a remote worker of their employee, of their company. And at the same time, I come to the conclusion that I need to have better monitoring of my personal health in terms of blood pressure and glucose and other things that I need to see monitored. So I can connect with the home care network that we are working on. And in using that, I can connect my devices by Bluetooth to my Care.Wallet and deliver that data as care cards to my primary care physician or Dr. S, and make sure that they are fully able to understand if I am performing everything I need to do and my body is responding to the care that they are prescribing me, all within one Care.Wallet. So the idea of this interoperability hub that is Care.Wallet, with my ability to choose which network I want to join, and the ability for the Solve tokens and care cards as the vehicle for payment and information exchange between these wallets, is something that, again, fundamentally redefines the view of how healthcare works and how it should work. So where we are today is that we have GTHE, we're getting close to launch. We have Diabetes Care Network. We have Team.Care Network. We are going to start working on the Home Care Network next. And the combination of these kind of networks through the Care.Wallet is the magic, the interoperability magic that changes the fundamental paradigm of healthcare. Now, what's really important is that as we are talking about these networks to new clients, for instance, we were discussing a home care network with a group of physicians recently, and their first question was, okay, do you support medical devices? And we said, sure, Care.Wallet can and will support the medical device integration directly so that we can capture all the device data as care cards and securely send them to your wallet. Great, brilliant, love it. How will I get paid? Well, you'll get paid in Solve tokens. Tell me more about that. It's a frictionless payment that allows us to connect Solve tokens to an act like sending and receiving a care card, as simple as that. Or it can be a continuous care model where you receive X number of Solve tokens every month from the Care.Wallet because you're providing ongoing care coordination. And listen, you can redeem these tokens whenever you want. And these tokens are available to you 24/7. And regardless of where the patient is, you can have and set your fees and receive payments instantly. What we have therefore discovered is that what used to be a conversation about why do you need crypto, why do you need tokens, what is this thing? Suddenly the conversation is, this makes total sense. I see the value of a global payment currency connected to multiple care networks, all of which can interrupt through one Care.Wallet, which means that I can take each patient down a different care journey and still have a completely seamless process of billing and receiving payments. And that's the foundation on which GTHE can really be a global telehealth network. Because not only are we delivering a global capability for physicians and patients to match through a medical need and medical capability exchange, we're also providing instant payments and instant information sharing. But more importantly, we're allowing the physician to migrate the patient from a single network participant to a multi-network participant by simply sending them an invitation card from their wallet saying, you need to join this network because given your medical data, I really think you need continuous care, and so on. So the entire model is coming together. It's not just about launching Global Telehealth Exchange. It's about Global Telehealth Exchange working with DCAN and with all the other networks that makes it so different than every other telehealth solution that is out there, including very large companies with massive valuations who could not replicate the functionality of Solve.Care platform that I have just laid out for you. Let's talk about Global Telehealth Exchange a little bit. Many of you know that our vision for Global Telehealth Exchange was not to just build another telehealth solution. Our vision was to make healthcare accessible. And I want to be able to see the doctor I want to see for my kid, regardless of where I live and regardless of where the doctor practices. As long as my needs and the doctor's acceptance criteria match, I want to know, is there a doctor in USA or a doctor in Singapore that matches my requirements? And if so, what will be the cost and can I afford it? And if I can, I'll pay it right now. And I want to know when is the first available time that this doctor can see my child. The goal is to break down these barriers. And in doing so, we needed several things. We need physicians worldwide. So one of the things I'm really excited about sharing with you all is that we are no longer a single country. We in fact never were, but unlike many other telehealth solutions, we truly are seeing physician community around the world sign up for Global Telehealth Exchange. And this is just a little snapshot, and although it probably has changed in the last 1 hour, where all we have physicians signed up from Global Telehealth Exchange. And this is yet a small snapshot of where we want to be, but just look at the diversity. We are basically following the sun. There is not a point in time where there is at least a physician not available on GTHE, regardless of time of the day. So we can truly follow the arch of the sun and say, at all points of the day and night, there is a physician community that is active on GTHE. This is pretty remarkable. So when you look at where we are, we have currently physicians signed up for Global Telehealth Exchange from 17 countries, and not just primary care physicians, but 33 specialties, ophthalmologists and radiologists and oncologists and so on. We have 7 countries in which we have currently active ambassadors who are recruiting physicians for us. These are physicians themselves. That's the most exciting type of ambassador we have. Physicians who love the concept and the capability of Global Telehealth Exchange and are talking to their counterparts. We have healthcare consultants. We have physician assistants who are out there promoting Global Telehealth Exchange to their physician network. And we have even medical professors who teach medicine in universities speaking about Global Telehealth Exchange. So this is a very powerful ambassador group, and it's only going to grow. Then what has really become very interesting is that we also have physician networks or physician groups. Think of them as affiliated group of physicians who work together or who share certain geography or some system or technology or facility together. And these networks, either through relationships or through contract, are very interested in joining Global Telehealth Exchange. And this network size is massive. If we were to just add up the number of physicians in the networks that we are currently talking to about allowing those networks to essentially come on to GTHE, we would be talking about tens of thousands of physicians represented by these networks who would have access to GTHE. So when we launched Global Telehealth Exchange, we were focused on providers, patients, and ambassadors. We were not really keen on doing a lot with the provider networks because we felt that's a future functionality. We'll come to that. But given the demand for it, we are accelerating the roadmap to bring the provider network capability onto GTHE, which means you can sign up as an individual physician, or you can also sign up as part of a bigger network on GTHE and essentially become a service provider of a network. So it's the true network effect, but it's also truly a network within a network. So Global Telehealth Exchange is a network, overall global network. And then within that, we can create specialty care networks or geographical networks that allow physicians to work together and to be represented by the network capability. So regardless of that, the model is still the same. Any patient can see any doctor around the world as long as their needs and the appointment requirements match. The exchange will match you and will allow you to make real-time appointments and real-time payments. Now, in terms of timing, I had mentioned in the last update that we are looking to accelerate some of the things, and we're looking to move some of the things further out. So here is the update. The provider wallet, which is the physician wallet, is launching in a couple of weeks, first week of October. Our plan was to launch it in Q4. First week of October would be the earliest days of Q4, and we plan to launch it then. I will give you a live demo. I will show you a slightly older version of provider wallet, so you can get a feeling for how elegantly simple it is for a physician to do practice medicine. The next big update is a Care.Wallet, which is the patient wallet, and that is coming in the first week of November, subject to, of course, the approval by App Store and Google Play. But that's our target for launching the Care.Wallet. And then, of course, the GTHE with full support for token, first week of December, allowing for seamless payment of Solve token from patient to doctor in real time. And that's the final step, at which point GTHE can be deemed to be active. And then we'll scale and we will promote and we will improve. But that's the roadmap that we are working towards. Now, what's really the key point here is that the Global Telehealth Exchange is being driven with the input of our physician community. We are not going to build Global Telehealth Exchange just in a vacuum. Our vision is to talk to as many physicians, either as physician users or as physician ambassadors or as advisors or all of the above, to give us the feedback they need during each phase. We need that feedback to make sure that GTHE really changes the way medicine is practiced, not just to build another telehealth solution, but to really change the way medicine is practiced and how patients and doctors find each other and how patients and doctors get information exchange and how they handle the payments, which is all of them are critically important components. So with that said, I'm going to switch over to showing with you the GTHE provider wallet. It's a few weeks old, but I thought it'll be good for you to all see it. So let me see if I can get us to switch over. Okay. So now you should see the how simple the physician can create a global telehealth ID. So the global telehealth ID is the permanent address on the blockchain for any physician. And all they have to do is to go to GTHE Solve.Care and they can sign up as a physician. The presumption is that if they cannot follow up their stipulations that they're a physician with proper documentation, the GTHE ID will not be active. But as long as they are able to prove that they are a physician to us through a credentialing process that follows, getting a global telehealth ID is very simple. They enter their first name, last name, their email, the country they can practice in, if they have a specialty, and if they have been referred by an ambassador, then they can get a GTHE ID. Once they have a GTHE ID, we send them the appropriate documentation and submission process for them to submit their credentials to us, meaning we need to know, where did you go to school? Where did you practice medicine? Do you have any kind of sanctions and or prohibitions against practicing medicine? What country and what state you have jurisdiction to practice care, clinical care, and so on. That process happens offline, and Solve.Care's team does that both in combination of internal review as well as we engage external experts if we cannot verify a physician's qualifications. But once those have been verified, the physician gets a login and a password to their GTHE wallet. And at that point in time, they can essentially set up their practice. So let's go and look at what the physician wallet looks like. So when a physician gets into their wallet, the first thing they can do is they see their unique global telehealth ID. I'm logged in as a pseudo physician, and I have the ability to share this global telehealth ID. I can print this ID on my visit card. I can publish it in my email signature. I can put it on my website. And this global telehealth ID can be searched upon by any patient using the Care.Wallet. So as long as they have this QR code, they can find me, they can look at my credentials, they can see my availability, my rates, they can see if I take an insurance company or not, all that in the Care.Wallet by scanning this QR code. So if a physician wants to be found, not just with an email and a phone number, but rather needs to be found as a whole entity, their digital avatar is accessible through this QR code. But let's move on further. So I, as a physician, have to be able to now set up my practice online. It's not just about doing a teleconsultation, I need to get paid. So what I do is I go into my appointments calendar and I set up my appointment types that I want to offer. Here, a physician, depending on the type of care they perform, can set up as many appointment types as they like. So here we have created an appointment model where you have annual checkup appointments. So I have set my rate for $300 for a 2-hour appointment to an annual checkup. I will accept these appointments automatically from any Care.Wallet as long as they are occurring. My calendar will only allow these appointments to happen on Thursday, Friday, Saturday. I updated my availability and rates last update here. And this type of appointment is now active, which means any patient around the world can look me up on Global Telehealth Exchange, find my rates. They can see these, they will see these rates and they can pick any appointment type they like. And depending upon the time and day they want to make an appointment, my exchange will match my availability to their request and will collect the payment. The payment that is collected by me from the patient is always in Solve tokens. I set my rate in US dollars, but it converts into the Solve token price in real time. And therefore, the patient pays me in real time in Solve tokens based on the price of the token that is at that moment in time. So the objective here is that every physician can decide who they want to practice medicine with, at what price they want to charge, what days of the week they have availability, what type of appointment is available on what day, what is my standard appointment hours, and so on and so forth. And I can go into my availability view and I can create a recurring view where I can decide which days and hours I want certain appointment types to be available. And then I can switch over to my actual view to see how many appointments do I have this week or this month so that I know what my schedule looks like. So I'm controlling both the appointment types and I'm controlling my availability by blocking out certain time of the day where I don't want to have certain online appointments. What are we really doing here? We are allowing the physician to decide how they practice medicine online. We're letting them decide how many hours a week they want to work. We're letting them decide which hours of the week they want to work. We're letting them decide which type of appointment they want to accept and what rate they will charge for that appointment type and what is the block of time they're willing to allocate for that appointment. And they're telling the Global Telehealth Exchange, this is the payment you need to collect for the appointment to be confirmed. Physician does not need to do anything other than set up the appointment types. Everything else is done by the exchange. So in terms of availability, in terms of payment collection, in terms of blocking the time on their calendar, done. So the objective here is that as long as a doctor can decide what is the duration of a standard duration of an appointment, what is the rate they want to charge, and what days of the week they want to practice care, and what kind, the rest of the work is done by Global Telehealth Exchange. They can also come in and load their patients. So let's say that I already have a panel of 2,000 patients, which is typically what a primary care physician has, about 2,000, 2,500 patients that they take care of. I can load them. I can add a single patient, entering them manually, or I can go in and add an entire database of patients that I have in the form of an Excel template, and I can simply load my entire patient list here. For each patient, I have the ability to take action. What's really cool is that I can, as a physician, create care groups. So every physician likes to segment their patients. This is the way you deliver better care. So you can create as many care groups as you want. So here we have created standard care groups for a primary care physician who's got diabetics. So he's got a diabetes care group. He's got a Medicare patient care group, which is elderly over 65. And he's got a pregnancy care group. We can create 5 more, doesn't matter. The point of this objective is that when a care group has been created, a patient can be easily added to that care group. So I can take each of these patients, and if they're not in one or more care groups, I can add them. So I can do a broadcast to my care group. I can send a how are you feeling today card to my entire care group, in which case every pregnant woman under my care will receive a care card advising her of what to do, what not to do in the first trimester, second trimester, third trimester, and so on. So the objective is to make practice of care for the physician as simple as deciding which card goes to which care group. We'll talk about that in a minute more. I can also create my how are you feeling today cards, as many as I want. So I can have a prescription reminder, a new appointment checklist, an annual checkup reminder, a eat properly, sleep well reminder, whatever number of care cards I want to create, how are you feeling today care cards, I can do that. Then I can simply take a care card and distribute that to my entire care group. And in doing so, I'm notifying hundreds, if not thousands of my patients of either a new treatment plan or a new prescription or reminders about their annual checkup and so on. So my ability to create a new care card, which I can then send to the patient's Care.Wallet, lets me configure interaction with individual or groups of patients with as simple as creating new care cards. And I can go in and create a brand new care card and choose from a library of functionality and visuals that a patient will enjoy receiving in their Care.Wallet. And now let's get into the exciting part. So let's say that I have a teleconsultation appointment. I can simply start a teleconsultation appointment anytime I want. And if they don't have a Care.Wallet, I can copy this link and I can email it to them and tell them that I need them to join this link with me, in which case I can have an emergency appointment or I can have a real-time appointment. And I just sent this link over to one of our team members who will now join me on the other side as a patient. So let me start my session here. And now let's see if we can get Agata to join us as a patient. Hello, Agata.
Hello, Solve.Care community.
So where are you dialed in from, Agata, today?
Well, I'm thrilled to dial in from my home office in Poland.
Great. And I presume you actually don't need some care because I'm not really a clinician, as you know well.
I'm doing quite okay today. Thank you.
And what are you currently working on?
I'm working on Global Telehealth Exchange Care.Wallet, which is a patient wallet.
And how are we doing on that?
We're doing quite great. Looking forward for everybody to see it.
Excellent. Thank you, Agata. Good to see you.
Thank you.
So the point here is that if you have a Care.Wallet, this conversation happens between Care.Wallet and Provider Wallet. And if you don't have a Care.Wallet, then a link can be sent over to the patient through email, SMS, or given to them by phone. And using that link, they can connect with the physician and they can make this teleconsultation happen in real time. We're looking to expand this capability significantly to allow for group conversation, but today, first release of care of the Provider Wallet is doctor-patient only. Later on, we will introduce the ability for a nurse to participate and so on and so forth. So this is the general idea of the Global Telehealth Exchange. We are sharing this with the physicians. We're getting their feedback. We will continuously improve this product. We expect to launch the production-ready version of this product on or about the first week of October. All our existing physicians who have signed up for GTHE can start using it. And then we look to have their feedback and we'll release a subsequent very quickly an additional version of this wallet once you've had a chance to play with it for a couple of weeks. And prior to December 1, we want to make sure that all physicians have had familiarity with the Provider Wallet and that they can easily use it, and we will add the rest of the functionality that they request from us. So that's a little bit about the Global Telehealth Exchange. Let me switch back to our presentation. So you saw the live view of the GTHE Provider Wallet. let me go to what we are really hearing from our physicians. So the bottom line is that the COVID-19 scenario of healthcare, post-COVID-19 scenario, is never going to be the same as pre-COVID-19. Healthcare has fundamentally changed, and we know it, and doctors know it. Patients may not have yet figured it out, but physicians know that the return to normalcy does not mean going back to the old way of doing business. So what does it mean? Physicians need a much more effective use of their time. The administrative barriers that were acceptable and somehow supported in the past simply do not work in the post-COVID world. There is a clear shortage of healthcare frontline workers. There is a clear need for patients to be seen in a much more effective way than bringing them into the hospital. There's a clear need for much more effective payments. And there's a clear need for referrals and information sharing to occur across hospital boundaries and certainly across boundaries of electronic medical record systems. Healthcare cannot be determined and defined by which EMR system the doctor has and whether or not the referred physician or the coordinating care nurse has access to that EMR or not. That centralized model of care, while it has made a lot of people very rich, has not served the patient well. And we absolutely stand with the view that Global Telehealth Exchange and Team.Care and Diabetes Care, these are networks that break down barriers to care, remove these access impediments that have existed and that have been promoted and celebrated in the name of interoperability. And we really, really need to move forward to where the patient and provider interaction is voluntary. It's determined based on the needs and the urgency of the care needed, and it should not be determined by which zip code you happen to be living in or were born in. That is exactly what we are trying to do here. And I believe that Global Telehealth Exchange is demonstrating not just the power of telemedicine, it's actually demonstrating the power of a telecurrency. The global cryptocurrency that Solve.Care has become, or the Solve token has become, makes GTHE possible. Because otherwise we would not be able to deliver a truly global solution. No matter where the patient and doctor is, and even if they can see each other through FaceTime today, the reason they can't see each other in a clinical setting using FaceTime is because there is none of the underlying infrastructure for appointment setting, for payment collection, for record sharing, for referrals, for care continuity, for consents, everything that actually makes healthcare work. Those things are not just about opening a FaceTime chat. It's about having a truly decentralized medical care exchange, which is what Global Telehealth Exchange is. And that's the reason why we are super excited about it. And I hope you, having heard this, truly begin to appreciate how disruptive and how fundamentally different GTHE is in terms of care delivery models, the pre-COVID world versus the post-COVID world. So this is our time to help the world move towards a better healthcare model. And you are part of this journey, and I'm very proud of it. Now, I mentioned that GTHE is not the only network. So let's talk a little bit about another 2 or 3 networks that we have launched. So Team.Care is a very interesting network that we decided to launch when COVID hit, and essentially we realized that there is a completely different dynamic in the workforce, and what used to work for Solve.Care team and work for every employer in the world doesn't work anymore. So we decided to build a Team.Care network as another form of a care network, with the idea that the employer-employee interaction should also be redefined the same way as patient-doctor interaction is being defined. So let's make sure that we have a way for the employer to help their employees be effective employees while working at home, be it mental health, be it physical health, be it COVID exposure risk, be it safe return to work. There is a well-being and an efficacy issue when employees suddenly go remote, as did Solve.Care employees and as did most of you. So we built a Team.Care network first and foremost with our own employees in mind, with the view that we need to be able to track their well-being and their efficacy when they're at home. But then very quickly we realized that this solution is applicable to most every employer on the planet. So we have launched the first version of Team.Care, which covers the exposure risk, covers their efficacy and effectiveness in working from home, covers whether they have inadequate or too much workload, covers if they are getting proper instructions and information from their direct managers, and covers any mental health issues that they might have as a result of being isolated at home. So this is a remote workforce well-being management system. And that care network also follows all the same principles of every other care network. Care.Wallet to access the network. The care cards that arrive in your wallet are subject to what you did and what your employer is communicating with you. And based on your actionability, different cards will arrive in your Care.Wallet. And in the next phase of this Team.Care network, we will also introduce Solve token as a currency to give to subsidize care for employees, for give them incentives, and to give them rewards to be effective while remote or in the office. And the key element here is that the employers need to ensure that their employees are not just effective, but actually able to sustain their remote work or their at-home work scenario. And we need to facilitate a rapid response between employer and employee. So that was built. We spent about 3 months building this care network. We launched it for ourselves, and then we launched it in collaboration with our first major client, Angel Kids, which is a group of physicians, pediatricians, one of the largest pediatric healthcare network in Florida. They have 7 facilities, and they have dozens of physicians who are collaborating under the Angel Kids pediatric delivery model to provide care to thousands of children. They needed Team.Care to manage the risk of exposure of COVID to their frontline staff, be it nurses or administrative offices, or office team members, or their physicians. And they adopted this Team.Care network. They helped us improve it. They've launched it, and they've already been able to manage the risk of a scenario where one of their frontline workers was exposed to COVID, and they were able to identify and isolate that person through their network very quickly, notify everybody else through their care network what they need to do to protect themselves, and continue business operations without having a significant impact. That was the vision behind Team.Care, and that is exactly what Angel Kids has done. So their medical director, Dr. Ashraf, has been a tremendous contributor to enhancing and improving the Team.Care network. And now we are looking at partnerships and distribution channels all over the world in launching Team.Care for other healthcare delivery organizations, as well as organizations like Solve.Care and the company that you likely work for in managing remote workforce management. So this is very important, again, for us in terms of the context of building different care networks on the platform. And it's important for you to understand that even though the problem is very different, we're not talking about diabetes care here. We're talking about remote workforce well-being and mental health management. The same tools, the Care.Wallet, the Solve token, care cards, and a care platform underneath it all, managing peer-to-peer communication, is exactly the same. So GTHE is built on the same platform as Angel Kids Pediatric used Team.Care, and it's the same platform that is being used or was used to launch the Arizona Care Network Provider Rewards Program. The same platform, just very, very different care network, but ultimately it boils down to different care cards and different roles in the network. So this is our vision. We should be able to solve any healthcare problem around the world by simply designing a care network on the platform, using the wallet and the cards and the Solve token that makes sense for that particular problem to be addressed. Let's move forward to one of my favorite care networks that we launched last year, the Diabetes Care Network. This care network was launched in partnership with Boehringer Ingelheim, and they remain a key partner for us. But we are looking to expand the usage of this network by other ACOs, accountable care organizations. Post-COVID, what we are starting to see is significant resurgence of interest in launching care management solutions, and Diabetes Care Network is a care management network. It focuses on the conditions of type 2 diabetes in adults, but the notion of a care management platform and care management network is really gaining tremendous traction, especially in the world where patients aren't coming into doctors and hospitals for regular checkups. The capabilities of Diabetes Care Network are really, really relevant to the market. So we are in conversations with other ACOs to launch and expand or adopt the Diabetes Care Network. That is very exciting. Dr. Hannekam is leading that. But what's even more exciting is that there is a conversation about, well, if I'm in Diabetes Care Network, can I see the patients through GTHE? If I'm in GTHE, can I refer my patients to Diabetes Care Network? And the answer is, of course, yes. That's the interoperability vision we started with. So the really exciting part here is to be able to allow the patient to easily join and switch between networks, and for the physician to know that a single episode of a telehealth consultation, for which they might charge $40, may require an ongoing care management participation, in which case they can refer the same patient to join their diabetes care network. In doing so, they can then get monthly care management fees, either from the patient or from the insurer or the government agency. The point is, now we are blending two impossible worlds: the value-based care model and fee-for-service model living together in the same care wallet, but being used at the right time for the right reasons. This is something that has never been accomplished before anywhere. And we do that by simply linking two care networks together through one care wallet, which is the primary purpose of the care wallet to begin with. I also want to talk about the provider rewards. So our first care network ever was the provider rewards network. And we built that on CareCoin, but we have since then decided to migrate the provider rewards to Solve tokens. So we really have one payment currency, and that's Solve tokens. So Solve tokens universality and the ability to be used in every care network really is now a driving factor. So we see that Solve token in itself is no longer a question in terms of it being used as a payment currency. And we see no reason why we need to support different types of coins. So every care network, be it Team.Care or DCAN or 2.0 or GTHE, when appropriate, when requires payment or value exchange between wallet holders, will use Solve tokens. The demand for provider rewards is very interesting. The accountable care organizations are certainly coming back to us after about a 4 or 5 month hiatus and saying, I want this digital currency payment system. It's real time, it's frictionless, it's low cost, it's auditable. My physicians are actually much more open to this. And if this allows me to shift between global telehealth exchange and diabetes care network and physician rewards all together, I essentially don't need much of the infrastructure I spend millions of dollars on. So we are in effect redefining the core infrastructure that a physician or a hospital or a physician network or even a large insurer needs to do effective payments and effective care delivery. So this individually, each network does something very specific, but collectively these networks do everything that you can want to deliver an effective care model. And that, I think, is the message I want you to understand. So where does that bring us? Here is my bottom line. In terms of the last 3 years, the first 2 years, we were teaching the market how blockchain and care decentralization and a decentralized ledger, distributed ledger will help fix healthcare. And people were like, yes, great idea, but really, really tough to do. Let's see if we can accomplish it. After continuously succeeding in the face of significant skepticism and continuously moving forward, the question then became, can you scale, right? Okay, so yes, you launched provider rewards in Arizona. Sure, you launched diabetes care network with BI. Sure, you launched Team.Care, for Angel Kids. The question is, can you scale? And that question really is no longer a question, because the interaction of these networks, the network effect, is now taking hold. And I predicted that, I had hoped for it, that we will have a true network effect of all these internet of care networks interacting with each other. But we are reaching that point, and I think the tipping point is GTHE. Because when you have a global telehealth exchange where physician and patient can interact on a specific care episode, and you can easily jump off from that to a continuous care model or an incentive-based payment model or a care coordination and care intervention model, as simple as simply swiping a care card and joining a new network, now you start to see the power of the interoperability of Care.Wallet. That's the tipping point. And if Solve token is a currency across all networks, which is where we have moved to very clearly, then you have not only the card interoperability, you also have payment interoperability. And that combination is absolutely phenomenal. There is nothing like it. So I'm more excited about Solve.Care's future than I ever have been before, because now I see the proof and I see the idea of interoperability replaced with truly decentralized care coordination, decentralized benefit coordination, and decentralized payment coordination. And that is really the future of Solve.Care in front of us. I'm going to take a complete shift away from the care networks and talk a little bit about this notion of decentralized finance for healthcare, because it is a really, really, really big opportunity. But in my mind, this opportunity needs to be thought in the context of what we just spent the last 45 minutes talking about, which is effective care delivery, removing barriers to access, and making payments truly global. So where does DeFi fit into that? So let's take a look. So my view is that the Solve community is one of the most engaged, most forward-looking, and really well-informed community when it comes to healthcare. You've been on this journey with us for the last 3 years, and many of you have stayed fully engaged with us through ups and downs and through market downturns. Although as a company, we have been very steady. The market has done a lot of things since the beginning of 17, and we have ridden through all of that noise to come this far, and we have much further to go. But this Solve community is a very powerful asset. This community understands healthcare and the vision for healthcare that we have, and has followed the accomplishments and the development of Solve.Care over the years. We want to leverage this community to bring a different kind of functional capability to the care networks. So our idea here is to leverage the Solve community to govern truly global decentralized finance solutions for healthcare. And leveraging the Solve community, we are publishing a DeFi healthcare constitution on how financial solutions for healthcare should be governed, how the community should manage, govern, publish, approve, and ultimately benefit from decentralized finance in healthcare. We have designed the idea that for various healthcare needs, you can create very need-specific asset pools. These asset pools can serve very different needs. They can be financing pool for devices. They can be collateralized pools for insurance. They can be lending pools to factor in emergency lending for complex procedures. They can be pools for elective surgery and cosmetic surgery. Pools can be designed for whatever the needs are. It can be a pool for drug research. These pools are governed by, as long as they're compliant with the Constitution in terms of patient rights and physician rights and do no harm and improve access to healthcare and improve outcome of healthcare. As long as the pools serve the global purpose of improving healthcare, the community can design and publish new pools. Pools can be contributed, and once the pool has gained a minimum required size, then distributors can be appointed to distribute the pool for the healthcare need that they are designed for. So for instance, if we want to build a pool for medical devices for consumers, and we have estimated that such a pool could easily grow into a global pool worth hundreds of millions of dollars, but let's start with a modest pool of $10 to $50 million. And we use that pool to finance devices, either for patients or doctors. And let's use this use case of physicians using the pool to acquire devices which they can then lend to or provide to their patients for ongoing home care. And the physician is paying for that device on a monthly basis. That pool would be reviewed and approved by the community. The contributors would receive a certain amount of interest on that pool, and the distributor would be given the authority to distribute that pool and would flow all the payments back to the pool, from where interest payments, principal payments, and ultimately even pool income can be distributed. And that income can be shared by the governance committee, the Solve community, if you will, the pool contributors, of course, their principal and interest, and some income sharing with distributors to keep them incentivized and distribute even more of the product. This kind of a model can be scaled. It can be scaled to not a few hundred million, but a few billion or even hundreds of billions of dollars. Why? Because if you just look at the device market and the consumer and the professional device lending, which there are no truly global solution providers. Everything is highly fragmented. Everything is incredibly localized. That market alone is $500 billion a year. There is drug market, which is another $500 billion a year in terms of how pharmaceuticals are consumed, be it generics or be it brand name. There is medical tourism. There is cosmetic and elective surgery. There is complex procedures that need to be financed. There is the financing of hospitals and operating rooms and funding for beds. There is financing for clinics, community clinics, which serve small groups and regional hospitals. There are so many opportunities in healthcare, which if financed through decentralized finance would not only make healthcare much more effective, it would also allow the community to have very meaningful risk-reward balance. Certain pools may be riskier and may require higher rate of return, and certain pools may be less risky and may have a lower rate of return. But all of that distributed through distributors makes healthcare work, DeFi work for healthcare. Solve.Care envisions that more than one network will serve as a distribution point for these products. So global telehealth exchange can easily support device financing as a capability. Diabetes care network can easily support consumer remote monitoring and care monitoring capability financed by such a pool. Team.Care network can offer similar financing capabilities. So the objective here is that depending upon the type and purpose of the pool, companies like Solve.Care and many other companies out there who are looking to innovate and offer very innovative solutions in telehealth and telemedicine and better insurance products and so on can benefit from these pools. So the community's job is to govern, approve, and contribute to these pools. The distributor's job is to distribute these pools through either physical or online solutions like care networks, and the interest and principal and income generated from this distribution function is then shared by the community members. We have designed a very, very detailed model on how such a DeFi solution would be launched and scaled in the market. We are looking at regulatory and risk and collateralization and distribution requirements. I have looked at numerous other DeFi solutions from simple to most complex and learned from them as to what works and what doesn't work in general sense and what will and will not work for healthcare. And I'm absolutely certain that the Constitution and the initial governance model that we are launching, along with the use cases that we are launching in the market, will make the Solve community absolutely the leader in bringing DeFi to the healthcare. Here are the first 4 pool types that we are contemplating. The pool type 1 is consumer medical device financing. US alone, that was $31+ billion in 1 year. There is professional facility and device financing. Think hospital beds and X-ray machines and CT scans and dentist chairs. That was almost $500 billion. There's a medical malpractice insurance pool, which can serve as a collateral for underwriting malpractice insurance in partnership with brand name insurers like AIG or Berkshire Hathaway. That's about a $15 billion a year play just in this year. And then there is entire very high risk but high reward pool type for drug discovery and research, which is again a massive area which the community would have to evaluate and decide if we want to allow for such contributions and such kind of pools to be created. The point is, on the left side, you have a very stable pool based on regular monthly lease payments or financial payments by doctors or patients. And on the far right, you have highly speculative pools where we are looking at financing promising drugs. It's up to the community to decide which and how many pools and what scale of pool we want to launch. But the point is, each of these are well-identified needs for which Solve.Care will be, and many other companies will be willing distributors for these products. And that's where we see the intersection. So Solve.Care as a company will not lose its focus on being the care coordination, care administration, and care payment platform. But we see that a DeFi solution that serves healthcare needs can easily become a significant advantage, both to the Solve.Care care networks, but also to healthcare in general. And the DeFi community can see real world adoption of DeFi beyond yield farming, beyond swapping crypto assets, to really delivering massive value to patient and doctor and generating much more sustainable returns than can be done purely inside the crypto space, while sticking closely to the concepts of DeFi in terms of transparency, in terms of liquidity, and in terms of the ability to deploy your funds where it makes the most sense. So this intersection of DeFi and healthcare that we are working on, and we will release much more details to you in the next few days, is absolutely staggering in its scale. And having already the distribution channel of care networks allows us to really seriously bring much more stable, much more attractive DeFi solutions to market than if we were just living in the crypto space. These are some of the device types that we're looking to bring to market through GTHE and through and make available for physicians. All of these devices are integrating with Care.Wallet for data capture. The physician has the ability to send this device directly to the patient's home and have that device be linked through Bluetooth to the Care.Wallet and capture automatically whatever data the physician wants captured through by sending the right care card to the wallet. These are the most commonly requested devices. There are others, also more complex devices and multifunctional devices. We are currently looking at partnerships in Taiwan, South Korea, India, in terms of device manufacturers and device partnerships. But the idea is that this kind of a capability added to the GTHE, this device support and data collection support with GTHE, gives the DeFi community a massive distribution channel for their DeFi healthcare pools to be utilized and for significant income to be generated. So the timelines from a DeFi perspective are to publish a legal, compliant, and scalable DeFi solution for healthcare. We are close to doing that. Before the end of the month, we will publish that full picture for you to take a look at. We will seek your input. We're going to want you to make sure that you deliver to us positive and negative feedback, and you tell us how we can improve the constitution. And following that, we will publish the smart contracts governing the pool, governing the DeFi solution and the constitution. Once we launch the DeFi solution in the market, the community will be able to mine governance tokens, which is really the foundation for voting and governance over DeFi. These governance tokens will most likely be mined using Solve tokens. And you will be staking Solve tokens to mine these governance tokens. Once we have enough governance tokens mined, then the constitution will be adopted through an initial vote, and community will approve pool number 1, and the pool contributions can begin. And then we can start repeating that process for other pool types, be it insurance pool or professional pool or cash flow lending pool. These are all pool types that the community will evaluate proposals and sign off on. My vision is that by end of next year, we are going to see a rapid adoption of significant number of asset pools and distributor agreements. So we can have a true impact on both the patient and the doctor and the hospital and the facilities, be it local or highly integrated facility networks, which can then start delivering care in a way that we truly need it, as well as generating significant and sustainable returns for the DeFi community. DeFi today is a few $1 billion big. Healthcare is a few $1 trillion a year. And bringing those two together, we should be able to generate more than enough value and more than enough differentiator for both the DeFi community and the healthcare community to see that intersection as a very big value creation. Let me switch over to the last piece of the presentation. I'm very pleased to announce we have recently brought on our Chief Financial and Administrative Officer, Ian. Ian comes from the utilities and from the public listed company space. He has worked, he's been the CEO and CFO of different companies that were listed on LSE or NASDAQ or OMX. And I particularly wanted someone in the team that knows how and when to manage capital markets, including doing an IPO. Ian came on board about a week and a half ago, and his objective is to take on all the back office defensive operations of the company: finance, legal, HR, compliance, reporting, planning and budgeting, and so on. Ian is based in London currently, although he is planning to relocate to Estonia, where he also spends a lot of time and has worked there for many years. And we being an Estonia company, it is only logical that our CFAO be based in Estonia. Very delighted to have him on the executive team along with Dr. Hannekam and Maria and other members of the team. So, and Ian has jumped in with both feet into the company and has really become very involved in terms of managing and our assets and managing our cash and managing our cash flow and planning and budgeting as we look to scale the company significantly around the world. The other big news that I want to share with you is that we have opened a Solve.Care India office in partnership with another company. We have launched what is called a BOT model, build, operate, transfer model, where instead of hiring, finding a new building and hiring administrative staff and then doing recruiting and then building out an operation, we are leveraging their existing footprint in India to build a Solve.Care team. We have already brought on 15 members into that team, and they are engineers and architects and product managers and QA engineers. And we are planning to really build out our support team there as well, because as we look to expand into Asia, and as we look to sign more clients in Asia, it is clear that serving them out of the North America time zone would not work. So we are looking to expand the support center so the sun never sets on Solve.Care. So we have a team active around the world, somewhere in the world, at all hours of the day and night. And with that view, India made a lot of sense in terms of being our APAC and Asia support, as well as development support team. So this is we started this project back in February, March to see how it works. We worked with 5 or 6 different companies in India and gave them contracts to work with us. And we picked one to really build out our Solve.Care India operation, and they're doing fantastic. So very pleased to see Solve.Care tap into different time zones and different regional talent pools so we can grow and scale the organization while keeping our cost bases reasonable. So where does it put us in a nutshell? Our big focus, our big priorities are to launch GTHE. I've given you a time frame for that, to drive Team.Care adoption by both healthcare delivery organizations and general organizations, to bring DCAN to other ACOs in the market quickly, to launch at least 2 more care networks. One of them is the continuous care monitoring network, which I mentioned with medical devices. And we are also looking at potentially launching a behavioral health, mental health support network. More to come on that as we get closer to signing contracts. The care platform upgrade, which is to enable for much more effective utilization of Solve token across all networks, current and future. And this is my favorite. Our goal is that by end of this year, third parties will be able to build care networks from scratch. So Solve.Care is not the only company who is in a position to build care networks. And I expect to see an explosion of care networks in the market next year, regional or global or both, built by third parties, running on a platform, utilizing Solve token, and accessible through the same Care.Wallet as we all use. So end of the day, my goal is to have a multitude of care networks in the market built around the Solve token and the Care.Wallet and the care cards in both regional and global utilization. GTHE is global. We might see regional networks launched by somebody in Vietnam or in Vienna. And the goal is to support such networks to be launched and utilized by the regional population without us having to be the sole builder and distributor of these networks. And then, of course, underneath of all of this is the plugging in the decentralized finance capabilities into these networks as appropriate and launching the decentralized finance model that scales well beyond Solve.Care. So I am absolutely convinced, and I see now proof, not just hope and not just aspiration, that what we designed, what we set out to build, a global blockchain healthcare platform with an idea of Solve token as the global healthcare currency, all of which accessible through a Care.Wallet that allows you to simply select and switch between networks, is absolutely the future of healthcare. We are seeing proof in the pudding on a daily basis. And I am positive that all the effort that we've put in for the last 3 years is starting to reach what is proverbially called a tipping point. So there is probably as much work ahead of us as we've done in the past, and we've done a lot, but I'm actually excited. I'm pumped, if you will. Not that we've ever had shortage of energy, but I'm truly excited about where we are at the intersection of GTHE and Team.Care and Diabetes Care Network and the utilization of Solve token across all of them. And more importantly, expanding these networks with the capabilities of decentralized finance. I think this is an absolute staggeringly large opportunity, and there is nobody on the planet that is better suited and better positioned than Solve.Care. I know we are out of time, and there are probably dozens and dozens of questions here. In the interest of time, what I will do is I'm going to have all these questions that you have submitted and more, I'm sure you will submit, answered through an AMA with you in the next couple of days or 3 days. So let's have the community members, those who are attending and those who will see this video afterwards, submit their questions over the next 48 hours or so, and I will jump on a Telegram AMA and I'll answer these questions as effectively and efficiently as I can. In a nutshell, this has been very exciting 3 years, but they are absolutely nothing compared to the excitement we feel about the future. And we really appreciate everyone's continued support, and we appreciate everyone's continued engagement. And if you were to ask me my #1 asset currently that Solve.Care has, it's certainly the platform, it's certainly the care cards and the Care.Wallet and the Solve token, but the #1 asset is the team and the community. So I thank you all for your continued engagement, and I look forward to speaking with you very, very soon.